You might be an endo warrior like myself, or a medical professional, or researcher, or maybe you have a friend or a loved one or a colleague who has this disease and you just want to learn more about it. Whatever you're here for today, thank you so much. Managing endometriosis really requires interdisciplinary care in this often fragmented healthcare system that we're navigating today. So I'm really looking forward to hearing more about the efforts of both the EndoRISE program and the endometriosis working group to increase research, innovation, support, and education for this disease. We're going to get into a lot of stuff in the next hour and a half or so, but I think a good place to start would be for each of the panelists to briefly introduce themselves. And audience members, you can scan the QR code right there for their full biographies. And I'm going to let them take it from here. So if you could please introduce yourself and talk about a bit how you participate in the care of or support of endometriosis patients and the specific role or roles you play. We're just going to go down the line.
Good morning. My name is Caroline. Haney. I'm a postdoctoral associate here at the Jackson Laboratory. I work along with Dr. Elise Courtois and the EndoRISE group. I focus on applying biology to understand endometriosis and really understand the underlying mechanisms of endometriosis. And I work directly with a lot of the doctors here at the UConn Health Center to apply that knowledge back to the patient so that we can get information from the patients and the doctors and know what we're supposed to be looking for. I'm specifically interested in pain mechanisms. Pain is one of the largest symptoms of endometriosis. So I'm a neuroscientist by trade. So I'm really interested in how pain is inflicted on these patients and how we can better understand that to get better treatments and diagnosis.
Just want to make sure it's on. Good morning, everyone. My name is Shantana Hazel. I am the founder of the Sister Girl Foundation. We provide advocacy, support, education, and awareness to individuals living through endometriosis, infertility, as well as breast and ovarian cancers. And our main job is making sure that no one is suffering in silence and making sure they have the resources that they need. They're educated on the disease and their families are educated as well and also have the support. Oftentimes we find a lot of folks come in and their family members have no idea what they've been experiencing. So part of our job is making sure that that educational component is there and also how to direct them into the right space so they're not having multiple surgeries unnecessary or they're not suffering in silence and not understanding what the disease is, what it looks like, and what it does. I'm also a part of the endometriosis working group. And we are global. It's not just here in Connecticut, but we started here because I am an endo warrior and thriver and conqueror, and I speak that into existence. And so what I went through, I never wanted anyone else to go through the same thing. I've had over 16 surgeries, and we'll talk about that. And a lot of things didn't have to happen, so I wanted to make sure that my community has what they need so they can survive through this illness. Thank you.
Good morning. I'm Jillian Gilchrist, state representative and founder of the endometriosis working group at the state legislature. And we bring together various individuals, either from state agencies, from community-based organizations, those living with the disease, national partners to discuss endometriosis, barriers, where we'd like to go, and then we develop policy recommendations that we bring to the state legislature.
Hello, I'm Alexis Newmark. I am one of the minimally invasive gynecologic surgeons here at UConn, and a large part of my practice is taking care of endometriosis patients from both a surgical and a medical perspective. My role in EndoRISE is to provide community outreach and education to school nurses, APRNs, college students, nursing students about endometriosis. My goal is not to create endometriosis experts out of everyone, but to really give them the tools they need to identify at-risk patients so that hopefully we can decrease this delay in diagnosis and even decrease long-term complications of endometriosis. One of my big goals is really to debunk any myths or misunderstandings surrounding endometriosis that has prevented patients from receiving the care that they need. And I've also really been trying to give a lot of resources for these patients and the providers so that they can empower their patients, give them the education they need to advocate for themselves and to feel empowered and create a community for themselves. Thanks.
Hi, I'm Kayla Olson. I'm a pelvic health physical therapist, and I'm the program coordinator for the state of Connecticut for Select Physical Therapy. A lot of our role is really treating the secondary musculoskeletal symptoms that come with endo and with the lesions and adhesions that occur. And so a lot of the times there's pelvic pain, there's low back pain, abdominal pain, and it's our job to really make sure that there's restored mobility, coordination, and function of these muscles.
Thank you all so much. This first question, I'm going to bop right back to you, Dr. Newmark and Kayla. Can you talk about some of the benefits of cross-education between physical therapists and surgeons who are treating endometriosis? And for both physical therapists and surgeons that are already practicing, as well as those who are currently being trained up?
So Kayla and I have been working very closely together to create a program where her physical therapists come to shadow me and our trainees go to shadow them. It's really been an excellent addition to our program. I think the benefit is that we really have a deeper understanding of what each other have to offer for these patients so that we know what gaps we need to fill to provide them with the holistic care that they really need with endometriosis. I think it also shows our patients that we have a coordinated multidisciplinary team for them as an individual. So it helps build some of that trust and adherence to their treatment program.
I second that completely. I think a lot of the times, so Connecticut is a direct access state. So a lot of the times, sometimes we are seeing these patients firsthand, and it's really important for us to recognize the signs and symptoms of endometriosis so that we can get them in with the proper care. I also think that a lot of people think that pelvic floor therapy is really just Kegels and strengthening, and we do so much more. So it really allows us to show what we have to offer to take care of these patients. And I think us being able to go shadow the surgeries and the actual follow-up appointments for these patients gives us a better understanding on what is actually going on in these surgeries, what's going on, and where these lesions can occur so that we can actually appropriately treat these patients as well.
Thank you both so much. I think, in talking about the whole patient, there are experts in the medical field for every organ in our body. And so I'm curious to know, both your thoughts, and other panelists can weigh in on this as well. What other areas of our healthcare system do you think could benefit from cross-education of endometriosis?
I think all. We really try to incorporate all different fields into our endometriosis group. We work closely with the colorectal, the bowel surgeons, the urology surgeons. Mental health providers are a very important aspect of this as well. Pelvic floor physical therapy. I think it really crosses over to their primary care doctors because a lot of these patients come to us last. They've seen so many other doctors, so many other specialists. So I think to have everyone else on board to recognize this, they'd probably get to us a lot sooner and save them a lot of testing that they didn't need.
The only other group that I would add is the orthopedic side. I think a lot of the times it's missed on the ortho side as low back pain, hip pain, abdominal pain, and they end up with seeing us. But I think it's missed a lot of, they're often told we don't know what else to do, and they're missing a big piece of it.
I am not a medical provider, but at the working group level, it's been interesting because we hear so often that people, it should really be no wrong door, because folks show up at various providers, gastro, urology, the pediatrician. And so the fact that so many providers don't know about endometriosis is one of the reasons it's being so delayed.
I will add this part. When she said everyone, it has to be everyone. There was so many times we go into our doctor's appointments and no one has any idea where the pain is coming from. They're sending you to the orthopedic or they're sending you to a gastroenterologist. You're going to all the wrong channels before you get to the right one to start. But all providers have to be a part of this and have to be educated in regards to endometriosis.
I want to come back to one of you mentioned that mental health is, one of the areas that could benefit from. I don't want to say more training, but it seems like we could really use more mental health professionals who just understand or have a specialty in chronic illness. The wear and tear of dealing with pain and these other full body symptoms day in and day out is so it's wearing on a person, and we already have a shortage of mental health care providers. That's less of a question, more of a observation. But could one or more of you speak to the importance of caring for one's mental health when it comes to managing endometriosis?
I'll share. One thing about when it comes to mental health, a lot of times as patients, we didn't realize that we should be focusing on our mental health. So that was the last thing that we took care of. No one paid attention to that part. So I always teach my patients, make sure that your providers are treating you as a whole from the top to the bottom. And so for our organization, I created tools for my patients. And one of the books I created was a journal. I have it to share because it's so pretty. But it's a new me journal. And this is where you put all of your information from your mental health to whatever symptoms you're having. Everything can go inside of this space right here because you want to make sure that you're tapping into everything. I know I suffered from anxiety and depression, and that happened because I didn't know that it was something at the time. And so I'm going through it, not realizing that it's a mental health issue. No one talked about that in the beginning of my journey. That wasn't a conversation. It wasn't even a thought. So I suffered by myself because I didn't want people to see that I was anxious or I was sad. And so once I started journaling and really getting my emotions out, I had an understanding of, wait a minute, this plays a part in this as well. And so I started teaching people to make sure that therapy is amazing. There's nothing wrong with seeing a therapist. You can be completely healthy and still see a therapist. Everyone has something, but in this space, it is needed. Whether you want to see a life coach or a not physical therapist, I was going to say physical therapist, or you want to see someone to talk to and go through any emotions that you are experiencing, it's necessary and it's needed, and our providers should be pushing it. So that's what I wanted to leave with that. Our providers need to push the mental health side of it to make sure that their patients are being taken care of all around.
Yeah, absolutely. And Shantana, while I have you on the mic, can you've been living with endometriosis for what, over 3 decades now, and you're a major advocate, in Connecticut. What are some other things you believe providers can do to advocate better for patients who either have endometriosis or think they might have it?
Listen. That's the key word. Listen, believe, have a conversation. The only way we can know what's happening with our patients if we listen to them first. The patients, I always tell your patients, this is a partnership. I come in as a patient and I tell you what's happening, what's going on, and you as a provider use your expertise to say, we're going to test for this, that, and the third. That's the only way this relationship will work, is if you treat it as a partnership. Patient-centered care is a real thing. and patients should be a part. So a lot of times I do get pushback from some providers, but I also have some amazing providers that want to be a part of the care, that want to know what can we do for the community. Because we're there, we're doing the work with the community members. And so a lot of times patients partner, providers partner. That's another thing that's important. You have to partner with community organizations who are actually out there doing the work, and the patients will come to us first, believe it or not, before they go to their providers. That was me. I went to the community first when I found one. And I found the ERC first, and I found them online because I was Googling and I was looking for help. Someone has to know something. So if the provider would actually be a part of that care plan with the patient, I think we'll get a lot further in that space. But it has to be a partnership. That's the only way the patient is going to walk away feeling empowered, inspired, and educated.
Yeah, really putting that emphasis on the patient as a whole. Caroline, I want to turn to you. You know a lot about endometriosis. You live with it day in, day out, and you've studied pain, as you mentioned, and pain mechanisms in this disease, and now you're with Dr. Courtois' lab here at JAX. What do you wish people understood better about this disease? I know, that's like a loaded question.
Yeah, I mean, I think what's hard is the internet is a whole wealth of information, and not all of it is correct. There's a lot, like Dr. Newmark was saying, there's a lot of myths out there, and so getting the information from the doctors and the professionals that deal with this day in and day out would be my primary thing. I think also it is, like we were saying, like it's a whole body disease, not just symptom-wise, but internally. Like this is affecting your immune system, it's affecting other organs. So a lot of the times patients have, and personally have like, oh, I have one specific symptom that's really affecting me, but then the more you dive into it, and if you actually go see a doctor, you find out, oh, well, I also have this other symptom, and they're like, oh, that's linked to that too. So it all really goes together. So I think, one, get the right facts. Two, listen to your body, and try to figure out what are your symptoms and what's going on. And I think that's it. I don't know, there's a lot.
Well, so let me ask you this. As a researcher, as a scientist, can you talk about what you see the role of your endometriosis research, in the support and advocacy of patients, which include yourself?
Yeah, I think the research, we don't know that. Well, we're beginning to know more, but we really don't know that much. And so it's really nice to be on that forefront of understanding biologically what's going on. And sometimes that gives myself and patients something to hold on to. It's like, this is real. Sometimes it almost feels like it's in your head. Like we were saying, the mental health aspect, but sometimes these symptoms make you feel like, is this in my head, or am I going a little bit crazy? But no, you're not. Like the biology is there. This is a real disease. And so I think that aspect of it, to be able to I'm very nitty gritty. I look at cells all the time. I actually look at patient lesions under a microscope and see them, and these are real things. And it's actually kind of incredible how much of your body is integrated. Like these environments are immune cells, they're neurons, they're your epithelial cells, your fiber, like all these cell types are all involved in it. And that is, it's incredible to understand, and how these cells are interacting that are leading to these symptoms.
So I heard you when you said that people think sometimes it's in their head. The providers told us that. That's where that started. My provider, I can speak for myself, and I know I'm speaking for many people that's out here. The providers will tell you that it's normal what you're going through when you're actually going through HE double hockey sticks. right? And so that's where that came from. But then I wanted to touch too on the research of it all. And I know for my community personally, the way we look at research and how we're invited to be a part of research and what does that look like. So I'm always challenging and asking questions of the researchers. How do you target your participants? How are you making sure that everyone is included? Because that's a lot of the questions and concerns that we get from our community. Just making sure, well, the doctors aren't talking to me about clinical trials or research or anything of that sort. So what does that look like? How does that make sure that everyone is involved? And there's a lot of myth, there's a lot of stigma behind research as it results to the underrepresented population, the Black community, and I'm included. And so I can say, going through this process, no one ever talked to me about research. No one ever asked me to be a part of a study or talk to me about any of that. So I'm always curious, and I like to be on panels and events in regards and research. So there's always a question that I always ask. So don't mind me if I start babbling about it.
Shantana, while I have you, can you talk a little bit about how you feel the conversation surrounding endometriosis care and getting diagnoses, especially for Black women who are historically not diagnosed as commonly as white women. Can you talk about how the conversation about endometriosis care and just getting that diagnosis has how you've seen that change in the last couple decades?
So I'll give you a little brief of how it started for myself. I won't be long-winded. So I went to my doctor's probably every other day, no exaggeration. And I was told, you should be stronger than that. The you people came out. And I was a teenager at the time. So I didn't really grasp the way that I grasp that now as an adult, as I was growing into my adulthood. And it was more so I'm going back and forth to the doctors and they're saying, there's nothing wrong. They sent me to a gastroenterologist because they said I had acid reflux. They said I had lupus. They said I had every other illness other than endometriosis. And so it took 14 years before I got diagnosed. There's still people today it's taking that long for them to be diagnosed. There's a lot of work that needs to be done. And so, yes, we do see some change, but there's a lot of change that can actually happen. In conversations, we can have them every day, all day. But we have to have actionable steps at the end of those conversations and then revisit just to see how that's going. So I'll fast forward to 26 surgeries, oh my God. No, not for me. 16 surgeries, right, of just going in, just doing anything. So a lot of times I feel like those surgeries that I had in the beginning was unnecessary. You're taking organs from me, but you're not educating me. You're not talking to me about the illness. I still have patients that have those conversations. They come to me later to say, well, I've had 12 surgeries or I've had 3 surgeries and I still don't have answers. I don't really know what endometriosis is. That's what lets me know we still have more conversations to have. I'll also say moving forward, like going forward, this is why it's important to have the conversation and to be open and for providers to listen, because we didn't get that. Providers didn't listen. So I felt like I was mutilated. I have to be honest. That's just how I felt. And I still feel that way. Why it's important for us to have these organizations and for us to be even individuals in the spaces, making sure that we have what we need as resources, education, correct diagnoses of endometriosis, not being dismissed. It's still happening. So when you say what's different then to now, very little. But there's been change, but there's a lot of change that still needs to happen. And so we have to be honest in these spaces, because if we're not honest, then we're not going to get anywhere. I can sit here and say, everything is great, everyone is moving along, and the work is being done is amazing, and we're making progress. But that wouldn't be absolutely true. There's some amazing providers and researchers who are actually making the mark. And so we stick with them so we can keep teaching them. So thank you.
Thank you, Shantana. 17 surgeries? 17 surgeries? Oh my gosh. Thank you so much for sharing. I want to turn to Representative Gilchrist. If you could just speak a little bit about, from the standpoint as a legislator, what's the biggest policy issue that you see often intertwined with endometriosis care?
Great question. I'll try not to be long-winded either. When we're discussing endometriosis, what often happens at the working group, kind of you need to be working on all things at once, but of course you can't. But that's why it's so important to have so many people involved in this work, and I call it a movement, because people can take different angles. At the state level, in Connecticut, continuing funding for the endometriosis biorepository, which is a key piece of EndoRISE, is essential. Because the work we're doing here is unique. We're the only state in the country that funds a biorepository. And since things are a little uncertain right now federally in terms of women's health and research, it's incredibly important that we keep that work going here. A piece that I'd love to see us move forward with, but keeps kind of hitting a federal wall, is insurance, which we could talk all day about healthcare, and I won't. But in particular, the way this disease and its treatment is coded for health insurance purposes is making it so when folks do finally access a provider who understands what they're going through and can get them the treatment they need, they're denied that care by the insurance. Or the provider can't take their insurance because it's coded wrong and they won't be paid appropriately. And so ensuring that at a federal level, we actually recognize this disease for what it is and pay for it would be incredibly important.
Thanks so much, Rep. Gilchrist. Unfortunately, I believe it's our time to hand the stage off to the next folks, but thank you so much to our amazing panelists for sharing your personal experience and, you know, your life work with folks here in person today and online. So round of applause for them.